Most people think joint pain is something you feel, not something you can measure. But after decades of working with patients, I can tell you, your blood holds quiet answers long before your joints start screaming. While you may feel pain in your knees or hands, the root of that pain might be quietly showing up in your bloodstream, unnoticed and untested. The blood doesn't lie. It reflects what's happening inside your immune system, your level of inflammation, and even your nutritional status. And yet, many people live with chronic pain without ever checking the most basic markers. I often meet patients who've struggled for months or years with joint pain, trying creams, supplements, or exercise videos, but no one has ever ordered proper lab tests. That's like guessing what's wrong with your car without opening the hood. Blood work isn't just for people with serious illness, it's a tool for understanding how your body is reacting. And when we understand the body, we can finally treat it with the precision it deserves. In this video, I'll walk you through the most important blood tests I use in my practice and what they can tell us about your joints. We'll start with the basics, like inflammation markers that your doctor should check when you report joint pain. Then we'll go deeper into autoimmune indicators, uric acid, and even vitamin deficiencies that quietly contribute to pain and stiffness. Whether you've been diagnosed with arthritis or not, this information could change the way you look at your own health, because joint pain isn't random, and your blood knows more than you think. Let's begin. Let's begin with the two most essential blood tests I check whenever a patient comes to me complaining of joint pain: CRP and ESR. These tests are often buried at the bottom of lab reports, but in my eyes, they're the first red flags or green lights when it comes to understanding what's really happening inside your joints. CRP stands for C-reactive protein, and ESR stands for erythrocyte sedimentation rate. Both are markers of inflammation, which is your body's natural way of reacting to damage, stress, or disease. Think of them as your body's fire alarms, quiet when things are calm, and ringing loud when something's wrong. Let's start with CRP. This protein is produced by the liver whenever there's inflammation in the body. It doesn't tell us exactly where the inflammation is coming from, but it tells us loud and clear that it's happening. In healthy individuals, CRP levels are low, sometimes almost undetectable. But in patients with joint pain, especially those with arthritis or an autoimmune condition, I often see CRP levels rise significantly. And what's powerful is how sensitive it is. CRP can spike within hours of inflammation beginning, even before you feel major symptoms. Then we have ESR, which measures how quickly your red blood cells settle at the bottom of a test tube. The faster they fall, the more inflammation is likely present in your body. It's an older test than CRP and not quite as precise, but it still offers valuable information, especially when tracked over time. I've had patients whose CRP was borderline, but their ESR told the real story. Something was smoldering under the surface. When used together, CRP and ESR give me a snapshot of both acute and chronic inflammation, and that can completely change how I approach diagnosis and treatment. One of the most common mistakes I see is when joint pain is labeled age-related without ever checking these two markers. Aging does bring changes, yes, but not all joint pain is normal. If your CRP or ESR are elevated, it means your body is actively fighting something. Maybe early arthritis, a mild autoimmune flare, or even an infection that hasn't yet been identified. These are things we can treat or manage, but only if we know they're there. I've seen countless patients spend years chasing relief without ever looking at their inflammation levels. I often encourage my patients to think of CRP and ESR as your internal weather forecast. If the skies are clear, low numbers, we focus on maintenance, lifestyle, and prevention. But if there's a storm brewing, elevated numbers, we take it seriously. We may dig deeper with imaging, further testing, or adjust treatment before pain becomes permanent damage. What matters most is that we don't guess. We measure, and then we act. Because the earlier we catch inflammation, the more power we have to stop it from stealing your comfort and movement. And no, getting these tests isn't difficult. A simple blood draw, a couple of days, and you have insight into something that's been hiding for months, even years. It's one of the easiest and most affordable ways to get real answers. I tell my patients, before you reach for another painkiller, reach for a lab report. Your joints may be hurting, but your blood can speak. You just have to know how to listen. Some joint pain comes from wear and tear, but sometimes the problem isn't mechanical. It's your own immune system turning against you. I've seen many patients who assumed their pain was just age, only to discover that their body had quietly launched an attack on its own joints. This is the reality of autoimmune arthritis, especially rheumatoid arthritis, RA. And blood tests can often detect it long before you see swelling, deformity, or lasting damage. There are two main markers I check when I suspect the immune system is involved: rheumatoid factor, RF, and anti-CCP, also called ACPA. Let's start with rheumatoid factor. It's an antibody, something your immune system creates when it thinks there's a threat. In people with RA, this antibody often shows up in the blood, even early in the disease. But here's the catch. Not everyone with joint pain and a positive RF has rheumatoid arthritis. And not everyone with RA will test positive for RF. That's why we never rely on just one test. We look at patterns, not single numbers. Now, anti-CCP is where things get more specific. This marker is a strong predictor of true rheumatoid arthritis, especially the more aggressive form. If anti-CCP is positive and the patient has joint pain, stiffness, or swelling, especially in the fingers, wrists, or toes, it's a major red flag. In fact, anti-CCP can appear years before physical symptoms, making it one of the most valuable early detection tools we have. I've diagnosed patients in their 40s, 50s, even 60s with early RA thanks to this test, before their joints had any permanent damage. These tests don't just help us diagnose, they help us plan. A patient with high anti-CCP and high CRP is likely facing an active autoimmune process, and that means we need to act quickly. We may refer to a rheumatologist, begin targeted therapy, or monitor more closely to prevent progression. Autoimmune arthritis is not something to wait on. Once joint damage begins, it's often irreversible. But when we catch it early, we can slow it down, sometimes even put it into remission. I know the word autoimmune can sound frightening, but I always remind patients, knowledge is power. Finding these markers in your blood doesn't mean your life is over. It means you've just been handed a flashlight in a dark room. You now see what's been causing your pain, and that means we can finally do something about it. Many of my patients with RA live full, active lives because they knew what they were dealing with and got help early. So if your joints are swollen, stiff for more than an hour in the morning, or if the pain jumps from joint to joint, ask for these tests. Rheumatoid factor and anti-CCP could be the missing puzzle pieces in your story. And if they come back negative, that's still helpful. We've ruled out one big cause and we keep searching. Either way, you walk away with clarity. And clarity in medicine is everything. Gout doesn't always look like the textbook description. Many people think it only happens to old men with red, swollen toes after a night of drinking and steak. But in my practice, I've seen women in their 50s, men in their 60s, even fit patients with healthy diets suddenly experience sharp, burning pain in their joints. And when nothing else explains it, one simple blood test often reveals the truth: elevated uric acid. Gout is more common and more misunderstood than most people realize. Uric acid is a waste product that forms when your body breaks down purines, natural substances found in many foods, especially meat, seafood, and alcohol. Normally, your kidneys filter out uric acid and remove it through urine. But when your body makes too much uric acid, or your kidneys don't get rid of it fast enough, it begins to build up in the bloodstream. And here's the twist. This extra uric acid can crystallize inside your joints. These crystals are sharp, needle-like, and incredibly painful. That's what causes a gout attack, not just inflammation, but tiny spikes inside your joint. I've seen patients come into my office thinking they sprained their foot, only to learn it was gout in the big toe, a classic first sign. But it doesn't stop there. Gout can affect the ankles, knees, wrists, elbows, and even the fingers. What makes it tricky is that the attacks often come and go. One week your joint feels on fire, the next week it's fine. That on and off nature makes people ignore it, until it keeps coming back, stronger each time. And without proper treatment, those crystals don't just disappear. They can damage the joint long term, even without constant pain. That's why I often check serum uric acid levels in patients with unexplained joint pain, especially if it comes on suddenly, feels sharp or burning, and affects one joint at a time. A normal level is usually between 3.5 and 7.0 mg/dl, but it varies slightly depending on the lab. The tricky part is that during an actual gout attack, uric acid levels may temporarily drop, so if we test too late, we might miss it. That's why I ask about history triggers, like certain foods or dehydration, and sometimes repeat the test later. A single test can save months of confusion. What I want people to know is that gout is not a moral failure or a lifestyle disease. Yes, diet plays a role, but genetics, kidney function, medications like diuretics, and even dehydration can all raise uric acid. I've had patients who eat clean, exercise daily, and still develop gout because of their family history. Shame and silence don't help. Information and treatment do. And yes, there are medications that can reduce uric acid levels and prevent attacks safely and effectively. But even without medication, small changes make a big difference. Drinking more water, limiting alcohol, and reducing red meat or sugary drinks can lower uric acid. Some patients benefit from cherry extract, magnesium, or vitamin C, though these are supportive, not cures. And movement helps too. Regular walking or stretching improves circulation and kidney function. My message is always the same. Gout isn't something to hide or suffer through. It's treatable, and the sooner we know what's happening, the sooner we can stop the cycle of pain. If you've ever had a joint that suddenly flared up for no reason, and the pain felt like nothing you've had before, ask for a uric acid test. It's a simple blood draw, but the answer it gives might change the way you see your pain forever. When patients come to me with chronic joint pain, they often expect to hear about arthritis, cartilage damage, or inflammation. What they don't expect is to hear that something as simple as a vitamin deficiency could be playing a major role. But time and time again, I've seen low levels of certain vitamins, notably vitamin D, B12, and even magnesium, contribute to pain, fatigue, and stiffness. These aren't just bonus nutrients. They are deeply involved in how your muscles contract, how your nerves fire, and how your immune system responds to stress. And when you're low on them, your joints feel it. Let's start with vitamin D because it's the most common deficiency I see, especially in older adults, people with darker skin, or those who live in northern regions with little sun. Vitamin D isn't just about bones. It regulates the immune system, helps control inflammation, and supports calcium absorption, which is critical for bone strength. Low vitamin D can make joint pain feel worse, muscles ache more, and the body feel heavy and tired. Some of my patients have been misdiagnosed with fibromyalgia or early arthritis, when the root cause was simply a severe vitamin D deficiency. A quick blood test and proper supplementation turned their life around. Next is vitamin B12, which is essential for nerve health. When B12 is low, nerves misfire, causing tingling, numbness, weakness, and sometimes even deep, aching pain that mimics joint problems. I've had patients who felt like their joints were failing them, when in fact it was their nervous system crying out for B12. This is especially common in older adults, people with digestive issues, vegans, or those on medications like metformin or acid reducers. If left untreated, B12 deficiency can cause permanent nerve damage, but again, it's easy to detect and simple to treat. We also need to talk about magnesium, often overlooked but absolutely vital. Magnesium is involved in over 300 enzymatic reactions in the body, including muscle relaxation, nerve signaling, and bone formation. Low magnesium levels can lead to muscle cramps, restless legs, stiffness, and even low-grade inflammation that irritates the joints. I've seen people with chronic tightness in their hips, back, or neck feel dramatically better after correcting a magnesium deficiency. Unfortunately, this mineral doesn't always show up well in standard blood tests, so sometimes I recommend a trial of gentle supplementation to see if symptoms improve. So how do you know if a deficiency is contributing to your joint pain? The answer is testing, but also listening. Do you feel unusually tired? Do you ache even after rest? Do you have brain fog, numbness, or poor recovery after exercise? These are signs that something deeper may be going on, and blood work can bring clarity. I always tell my patients, before jumping to injections, medications, or surgeries, make sure your foundation is solid. That includes these basic, powerful nutrients that support every system in your body. Correcting a deficiency won't fix arthritis or reverse joint damage, but it can reduce pain, improve energy, and help every other treatment work better. And in some cases, it can stop mild pain from ever becoming chronic. I've watched patients go from everything hurts to I feel like myself again, just by replenishing what their body was missing. Sometimes healing doesn't begin with a pill, it begins with a missing piece. And vitamins, as small as they seem, can be that missing piece. There's a moment I've seen play out hundreds of times in my office. A patient walks in with real pain, real stiffness, real fatigue, and a stack of lab results that say normal. They look at me, frustrated and defeated, and say, if everything's fine, then why do I feel so awful? And I always tell them the same thing. Just because your blood looks normal doesn't mean nothing's wrong. It just means we haven't looked deep enough yet. Standard blood tests are helpful, but they aren't perfect. CRP, ESR, uric acid, vitamin levels. They're all pieces of the puzzle, not the full picture. These markers have normal reference ranges, but those ranges don't always reflect how you feel. I've seen patients with CRP levels just under the cutoff, still normal on paper, but their joints were inflamed, their energy was low, and their body was screaming for help. You can't treat a lab result, you treat a person, and your body knows more than a number ever can. Sometimes the problem is functional, not yet visible on labs. This is where early inflammation, immune dysregulation, or even hormonal shifts can begin to affect how joints move and feel, long before blood tests confirm it. Think of it like a crack forming under the paint. You may not see it yet, but you feel the pressure. I've had patients with perfect x-rays and clean blood work who still couldn't lift their arm or kneel down without pain. In cases like that, we dig deeper, looking at patterns, timing, triggers, lifestyle, sleep, stress. The human body is layered, and the lab can only reach so far. I always encourage patients not to lose hope just because their doctor said, "Your results are fine." If you feel something is off, it probably is. You live in your body every single day. You know when something isn't right. Sometimes what we call normal is just the average of a very unwell population. And sometimes the lab tests we run are too basic, too broad, or too outdated to detect subtle imbalances. That's why a good doctor doesn't just look at numbers, they listen to you, your symptoms, your story. There are also more advanced tests that can reveal things standard labs miss, like ANA panels, cytokine levels, food sensitivities, or even gut microbiome mapping. While not always necessary, they can be powerful tools when pain has no clear cause. But even before those, we can often find answers by simply looking at the whole picture. What you eat, how you move, how you sleep, what stresses you carry. Pain isn't always a lab result, it's a signal. And just because it's not visible on paper doesn't mean it's in your head. It means we need to listen better. So if your joints hurt, but your blood work looks fine, don't give up. It doesn't mean the pain is fake. It means the search isn't over. Your body is trying to speak, even if the test didn't catch the words. And a good doctor will keep listening until the message is clear. When it comes to joint pain, there is no one-size-fits-all answer. What works for your neighbor, your spouse, or even your younger self may not work for you today. That's why blood work isn't just about checking boxes. It's about creating a personal map of what your body is trying to say. And when that map is read correctly, it can lead us straight to relief, healing, and hope. After decades of working with patients, I've learned that the most powerful medicine is often understanding. Let's take a step back. If you've made it this far, you now understand how inflammation markers like CRP and ESR tell us when the body is on fire. How rheumatoid markers like RF and anti-CCP can catch autoimmune conditions before they destroy your joints. How uric acid levels can reveal the sharp truth behind sudden stabbing pain. How vitamin and mineral deficiencies like low D, B12, or magnesium can quietly worsen everything without making a sound. And how even when everything looks normal, your body may still be whispering if someone is willing to listen. That's why I don't treat lab results in isolation. I look at the whole picture: your story, your symptoms, your lifestyle, your labs. I compare what your body is showing me with what you're telling me, and I connect the dots. Because pain doesn't exist in a vacuum. It's influenced by stress, sleep, food, hormones, movement, and the quiet patterns that develop over time. When we put those patterns together with blood data, we stop guessing and we start understanding. Personalized medicine isn't about fancy technology or expensive tests. It's about asking better questions. It's about choosing the right tests for the right person at the right time. If you're someone who's been living with pain and frustration and still doesn't have clear answers, this is where we begin. Not by jumping to surgery, not by masking pain with pills, but by asking your body what it needs and listening closely to the response. I've seen lives change with a single lab test. I've seen pain vanish after discovering a simple deficiency. I've seen fear replaced with clarity. Not because the problem was small, but because we finally saw it clearly. You deserve that clarity. You deserve a plan that's built around your real biology, not just assumptions. And your blood is one of the most powerful tools we have to build it. So don't settle for vague answers. Don't accept just aging as a diagnosis. Ask for the right tests. Ask for deeper questions. And most importantly, believe your own experience. Your body knows. Your pain is real. And with the right approach, so is your healing.